Good afternoon. It's Thursday, July 19th, and I'm here to prepare for next week's class in Nursing and Health Informatics. We're going to be focusing on a wide variety of innovative clinical information systems uses. You might have noticed that the readings for this week are a little unusual, and that the activities are also a little bit different. That's in part because I know everyone's quite busy finishing up the paper for the first field project and getting ready for the semester project, and also getting ready for the second field project. Before I begin my comments about the readings today, I want to talk to you a little bit about two of the assignments that are coming up. First, the field project number one is due tomorrow. That's Friday. Several of you will already have turned it in by now. This project, as you recall, focused on helping you to understand a patient problem from two very different informatics perspectives. One was the problem of patients who receive care largely through the internet, patients who self-select to use information, and to give you a feel for how to begin to appraise the content on the internet, not from the perspective of the clinical quality of it, which of course is something that's very important, but from the informatics perspective. How's the navigation? How easy is the layout? Can you find the things that you're looking for? The second perspective we're looking at is is public health information collected through general service public health information databases, and to see how they can be made useful for nursing. You probably noticed that the information databases are pretty general, and in order to begin to drive patient care or patient information, you'd have to really be able to understand things from a nursing perspective, the nursing diagnosis and intervention, or maybe things more in depth from the SNOMED perspective. You may be catching a lot of background noise and a lot of people walking behind me. I'm currently at the O'Hare Airport Admirals Club, so I apologize if this is a little difficult to hear, but I wanted to be sure I got to you before you got too far into your readings for the weekend. Next week on Tuesday afternoon, we hope to have Nikolai Koryenko, to talk with us about some of the patient perspective when using self-monitoring tools from the Project Health Design. I still have not heard if Nikolai is better or not. He spoke to me on early Tuesday morning and was really not well, but I should hear from him over the weekend, and I'll confirm. Our topic for next week is a diverse set of clinical information systems and public health information systems. You're going to be focusing on on three chapters from the textbook. The chapter number 4, which focuses on cognitive science, how people think, and then the chapter on population and community and public health, and the chapter on bioinformatics. The focus this week is moving from information systems as a repository of data, which we talked about in the very beginning, and information tools as a patient care source, which we talked about last week in terms of patient and public health, public communication. This week we're going to be talking about decision making and decision support. So as you read through the chapters, I want you to be focusing a lot on what are the tasks of decision making. We draw from cognitive science to understand that decision-making has 4 key tasks. First of all, there's the need to be aware of the need for a decision, a monitoring activity. Second, there's a search for relevant information. Third, there is an integration of that information into some sort of a platform for action. That's where artificial intelligence comes into play, and also the paper that you read by Bakken and Lee. And finally, there's the action. So in my work, my original studies were in decision making and decision support, and we believe that decision making is an irrevocable commitment of resources. So as we look at clinical decision support systems, we look at clinical information systems, electronic health records, not only that store information about patients and our recordings of what we want to do to take care of them, but also that provide information about the care of individuals and how to take action based on their information. You might have seen a range of decision support tools, including tools that provide warnings and alerts when laboratory values are out of range, or maybe when an electrocardiogram rhythm is wrong. You might also have seen tools that help guide you through the collection of specific data to determine whether or not a patient is eligible for a particular guideline. There's a large range of decision support tools being built now. Some of them are being built for nursing care. Many of them, frankly, are more broad-based and are used for general services in patient care, but not specifically for nursing. Decision support systems are an important application of clinical information systems. Your text touches on them very lightly, but the paper by Bakken and Lee actually gives a really interesting and very exciting view of how one might use mobile technology to assist in implementing a guideline-based care, evidence-based practice for the care of patients in a public clinic. This is a federally qualified health clinic. I think you'll enjoy that paper very much, and it'll be a nice introduction to field project number 2. The Community and Population Health chapter introduces you to a much broader use of technology and information than what we've done with the WISH database so far. You'll be introduced to ideas of syndromic surveillance and the role that clinical information and public health information systems, and frankly general information systems, can be to help us better understand when outbreaks are occurring or how to respond to them. There's some good evidence that says if you simply monitor the number of cases of Pedialyte that were purchased in drugstores and of tissues that were purchased, you can determine whether or not a flu outbreak is occurring. Nobody in this room seems interested in my lecture, so I don't think we have to worry about them too much. Um, Another specialty system that you're going to be learning about this week is the clinical information systems built for intensive care units. I focus specifically on the EICU concept, that is, using clinical information tools to bring the skill set of intensivists wherever they're needed. This is a new and evolving model of clinical care supported by information technology, one that takes away the idea that we should have regional centers of excellence, but also that we should provide adequate support to individuals who are at the point of need. The EICU concept is becoming more widely accepted. I want you to be looking carefully as you look through the different videos at what the various roles of nurses are in using those electronic health information tools. The last chapter I'm having you read for this week is a chapter on bioinformatics and biomedical informatics. Bioinformatics is an emerging and extremely exciting area. Ricardo will probably be most excited to see this because we're finally getting into a topical area that's closer to the CIBM training program. Over the last 15 years, the explosion of genetic knowledge has led us to require new kinds of information systems to take advantage of the genetics knowledge and, frankly, to organize it. So sets of ontologies have been developed and ways to categorize genes and their function and their structure, ways to categorize proteins and the manner in which those proteins activate genes are becoming essential parts both of discovery and eventually of clinical care. You can imagine, for example, the case of a patient who has familial adenomatosis polyposis, a disease also known as FAP. This is an inherited genetic disease, and it's caused by the genetic mutation that occurs on one specific codon. If that mutation occurred before codon 1251, surgical treatment is indicated. If it occurs after codon 1251, medical treatment is indicated. Consider now the busy clinician at the point of care seeing a patient who's just been diagnosed with FAP. It's important that the clinician understand the patient's genotype, be able to, and phenotype, that is, the genotype, their gene structure, the phenotype, their body and clinical portfolio. It's also important that the clinician understand what treatments are available, what treatment is indicated for this particular patient. Does the patient's insurance actually cover that treatment? Is the treatment available someplace in the local area? All of these pieces of information need to be brought together at the point of care for a type of decision making. So we cycle back now to the content that's in Chapter 4 on cognitive science. Think about the cognitive tasks that individuals are facing in their work and how information technologies must be built to help them with that. We're really almost at the infancy of this level of sophisticated decision support. In fact, it's been a long vision of many individuals in the field that we would have decision-making tools that could be made available on demand. You'll see in our readings for next week the work of Kohani and Mandel that are making those almost real, almost possible, but not quite just yet. In addition to your readings this week, you're going to be watching several videos. These videos are of EICUs, and while I want you to understand the clinical practice, I'd like you to keep in mind the SEEPS framework as you're listening to the various interviews that talk about the tasks that need to be accomplished. Sorry, excuse me, there's a loudspeaker. Okay, the loudspeaker's gone. So the clinical information system that is envisioned by Kahani and Mondal is one that's really not even possible right now, but it's a system of the future where streams of data from the patient's genetic structure to the amount of gases that occur from the synthetics in their house to their past eating habits get brought together at the point of care where clinicians can make meaningful and interesting and appropriate decisions with patients as well as for them. I want to finish my remarks today by introducing you to Field Project number 2. Field Project number 2 will be due on July the 30th at 7 a.m. This is a project that will introduce you to clinical information systems. You'll be making a field site visit, watching a person in action as they use clinical information systems. As you look over the Field Project number 2 description, which you might want to have as you look through this, listen to this tape, as you look through that, you'll see that there's really 5 discrete activities, but I want you to begin at the bottom of the list. I want you to start to put together and understand, do the readings for the Tiger Usability Initiative, for the instrument to understand the clinical information systems implementation, and the guidelines part of the project. Plan that before you go in and actually do your observation. It'll make your observations much more useful. You want to coordinate with a clinical informant. You only need to do one to be able to observe them using a clinical information system. That means the information system must have patient data in it, even if they use it for administrative purposes. I want you to get a feel for issues of security, the adequacy of the information, whether or not terminologies are present. After you prepare yourself for the interview and prepare a set of questions, you'll go on site and observe your key informant for at least 2 hours, 1 to 2 hours, so you can get a feel for their daily work. Remember to be respectful that you're coming into a clinical space, that they may need to have privacy, they may need to ask you to step out on occasion, and certainly please don't record any patient data. But try to get a feel for the clinical information system, and then make sure you ask your key informant some of the questions that will help you write your short paper. How good is the system? How helpful is it? Is there problems that you should know about? Make sure you also get some brief description of what the system is. Is it an Epic implementation or a Cerner system? I hope you enjoy the activities this week. You should be feeling a much greater sense of integration of the course material. I'm looking forward to seeing you on Tuesday evening, and please contact me if I can be of assistance to you. Thanks very much. Bye now.